Hi, everyone. I want to welcome Dr. Jessica Zwiener. She is a board certified endocrinologist who specializes in transgender medicine in Houston, Texas. And the name of her practice is Braeswood Endocrinology. Thank you so much, Jessica, for being here. How are you doing?
I'm doing well. Thanks for having me, Saya.
Of course. And I really appreciate your time because I know you are literally about to have a baby. And
One more week.
yeah, so, congratulations. And thank you for, giving us your time in this, very possibly chaotic time of your life.
Well,
And
thanks for having me on. This is an important topic, so I'm happy that you guys are covering it.
yes, and completely agree. So before we get into our topic, which is the care of transgender and non-binary persons who are assigned female at birth, and we will also cover trans women as well. Uh, can you tell us a little bit about how you got into this field of medicine?
I kind of fell into it. I've always thought that gender was interesting, and I never thought I could do anything with it. I thought that the only doctors who took care of any kind of gender issue were surgeons who operated on intersex babies, and I knew I didn't want to be a surgeon. So I went through med school and kept thinking it was interesting when it and ended up in endocrinology, and then realized, hey, endocrinologists take care of transgender people. I didn't learn anything about trans folks in med school, residency, or fellowship. Um, Everything is self-taught. There are resources out there to learn, but they're hard to find.
Mhm.
Um, and I started my own clinic. I never thought I'd attract very many trans folks. I thought I'd be taking care of mostly diabetes, but it was something I wanted to offer.
Mhm.
And the only people who've shown up have been transgender, which has been wonderful. It's such a fun, rewarding population to work with.
That's awesome. No, and we need more education and uh, definitely
Definitely.
more awareness in this entire space. So let's start with the basics. Can we talk about terminology? This is something that I'm still learning, and I know that there's many healthcare providers, and not just healthcare providers, but people that probably don't know what a cis woman means or
Mhm.
a non-binary person means. So if you can just sort of give us the lay of the land.
And the terminology is always evolving. The trans community is very focused on making sure that everyone feels included, which obviously is important. That does lead to terminology changing frequently, so everyone does need to remain open and know that the terminology that you master might change in a few months. So to start out, we talk about birth gender or birth sex as, let's start with sex versus gender first. Sex is what you are physiologically, biologically. It's determined by your genetics, by your chromosomes, by the hormones that you've got, by the secondary sex characteristics that you've got, by the gonads that you have, if you have ovaries or testes or both or a combination or neither. All of those together will determine if you are male, female, or intersex. So male people have um, testosterone, they're usually XY, they have testes, they have facial hair and body hair and that sort of thing. Female people are generally XX. They have an estrogen dominant set of hormones. They have breast growth and things like that. Intersex people have a combination. So maybe they're XY, but they look female. They have female secondary sex characteristics, that sort of thing. Intersex is a very it's a very broad category. It includes lots of different things and phenotypes. Most people are endosex, not intersex. They're either male or female, but quite a large number of people are intersex. So some people never find that out because they're able to, they pass in their life and they're able to have kids and things like that.
Mhm.
Um, so that's sex. Gender is whether you feel like you're male, female, both, neither, non binary, agender, or something like that. It has to do with what's in your brain, not what's between your legs or what your biological, what your genetics and hormones are saying.
Mhm.
If you are cisgender, that means that you feel like the gender that you are biologically, the sex that you are biologically. If you are XX and you have breasts and you have estrogen in your body and you feel like a woman, then you're cisgender. Most people are cisgender, some people are transgender. And transgender is when your sex and your gender are not the same. So maybe you are XY and you have testosterone in your body and you have testes, but inside your heart, you're a woman. That's transgender. The treatment so what can happen then is you can get something called gender dysphoria. And dysphoria is a feeling of distress when your outside and your inside don't match.
Right.
Not all trans people have dysphoria. Some people are perfectly comfortable with their body, but most want to change it and to bring their physical body more in line with who they are on the inside. Being transgender is not a medical problem. It's not a medical issue. It's not a diagnosis, but gender dysphoria is the issue. So if you have distress because your sex and your gender don't line up, we fix that. And we can get into transition a little bit more after that. But so we talked about cisgender and transgender. Some people identify as non-binary. Non-binary means they feel like you're not male, you're not female, you're somewhere in the middle, and maybe you're both. We're recognizing that gender exists on a spectrum. We don't just have male and female.
Right.
And that's how most of society is classified and categorized. And usually it works pretty well, but frequently it doesn't. And so non-binary folks, are somewhere in the middle. And they tend to use they, them pronouns instead of he or she. But every non-binary person is different.
So before we actually get into my next question, can we talk a little bit about pronouns? Because what do you think, or what does the community think, like, is the most appropriate way to sorry, I'm gonna have to pause. Oh my god, I felt that coming for a while. I was holding it back. Okay. So I'm just gonna ask you that again. So I want to ask you a little bit about pronouns. What are some of the sort of pros to sort of everyone using pronouns, and then what are some of the cons to it, right? Like I know that you identify as she, her because you put it into your recording box, and so that was very clear to me. But how do we approach pronouns?
So using the correct pronouns is very important. Identifying people and gendering them the way they want to be gendered is, it's a treatment for dysphoria, it's suicide prevention, it's what we should all be doing just as a matter of respect for other people. The pronouns are kind of a controversial issue in that most of the community feels that everybody should be identifying their pronouns. Hi, my name is Jessica Zwiener, I identify as she, her, nice to meet you. And if everyone does it, then it doesn't put the onus on just the trans people to use their pronouns. Some people will then push back against that and say, well, I shouldn't have to identify my pronouns. You should just look at me and call me, the way that I'm presenting. Maybe I have a little bit of 5 o'clock shadow, but I'm wearing a dress and jewelry and I'm clearly presenting as a woman. You should call me she, her. The most important thing is just to be respectful. If you don't know someone's pronouns, you can always ask, what pronouns do you prefer? That's not an offensive question. And the more we ask that, the more it will become normalized.
Yeah, I think that's something important now to include on healthcare intake forms as well, from a physician and provider standpoint, to add that to your question.
And it's important both medically and psychologically for patients. If you come in and it just has a mark for gender, it's like, well, do you mean, if you're a transgender person, do you want my sex assigned at birth? Are you looking for my gender identity? Are you looking for the hormones that I'm taking? There's not a place to do that. On our intake forms, we have sex assigned at birth, gender, and do you identify as transgender? And that gives us all the information that we need.
Yeah, I think all those pieces are obviously important. And for someone watching this, that maybe this is something that they're thinking about, they may be, just up there. How did I ask that question before?
Thinking about transitioning?
Oh yeah, okay. So for someone watching this that may be thinking of transitioning, what are some of the resources that they can use or go to start the process, or what's the first step? I'm sure it's an overwhelming journey.
It's definitely a big decision. It's a huge life decision. And it's one that it can happen on many different timelines. Some people, boom, they realize that they're transgender and they call up a therapist and they call up their, a hormone prescriber, and, they just go full steam ahead. And some people, it takes some years. And either way is okay. There's not one way to transition. Usually most people, by the time they've called me, have done a lot of soul searching, both by themselves, with partners, with friends. And so they already have a good idea of where they're at. If you're just starting to get an inkling that, maybe I'm not cisgender, maybe there's a little bit more to my gender identity than I realized, one of the best things you can do is get hooked up with the local trans community. Trans folks have traditionally been a marginalized community, which has meant the community itself is very tight. Trans folks generally take care of each other, and they know all the resources. They will know, oh, if you want hormones, you go to this doctor. If you want electrolysis, you go to this place. If you want, you want to buy a bra and breast forms, you can go here, and they won't, make fun of you, and they have the right sizes. Of course, with COVID, it's hard to find in-person support groups. Most of them have some sort of online option. And there's tons of online resources. I mean, there's the big ones like PFLAG and things like that. But even if you get on Facebook or Instagram and look for local groups, I'm in Houston, we have a couple of different Houston transgender focused Facebook groups. And it's nice to just reach out, introduce yourself, meet some people. That's where you can ask your questions and get good answers.
And can you also comment a little bit for parents? When does the discussion start? I'm a new mom, and is that a discussion you have? I really don't know. Is my son just gonna one day know that he's a boy, or where does the parent begin?
Gender identity really starts to solidify around age 3 to 5. And even talking to my folks who come in and start their medical transition at age 70, they usually tell me that they've known something was different since they were between 3 and 5 years old. But how parents respond to it is a big difference. I had who I thought was a son, assigned male at birth, who started requesting dresses at 2.5. And so I never told her that, no, dresses are for girls, dresses aren't for boys. I kind of followed her lead. And that's what's most important, is you want to just follow your kid's lead. You don't want to push any sort of gender norms on them. They will figure it all out. And my daughter ended up transitioning when she was about 3.5. We had some conversations about, some girls have penises, most girls have vaginas. That's okay. But we gave her that vocabulary. What happens with most kids who start identifying cross-gender behavior is that their parents tell them, no, that's unacceptable, or they get beat, or they get punished. And that doesn't make your child any less transgender. It doesn't change their gender identity. It just teaches them that home is not a safe place to express any of those opinions. And it leads to pretty major depression, cutting, self-harm, suicide attempts by puberty. And so the earlier your child is able to transition, the better their mental health outcomes. But in short, to answer your question, you just follow your kid's lead, provide a variety of toys, provide a variety of clothing options, let them make their own choices, and they'll let you know.
Okay, no, that's great. That's great advice. What are the different ways that people transition?
So transition is different for everybody. Most people start with social transition, which doesn't involve any kind of hormones or medical care. It just is picking a new name, using new pronouns, changing the things that are easy to change. If you're a trans woman, you can grow out your hair, you can, shave your face, you can wear makeup, feminine clothing, heels, all that sort of stuff. If you're a trans guy, usually a haircut is the first thing that happens. And then, typically masculine clothing. When we talk about transgender kids, the only thing that happens transition-wise until puberty is social transition. So there are, scary things in the media about giving hormones to 5-year-olds. That doesn't happen. There's no medical transition until puberty. Some trans folks choose to have a legal transition, which is changing name and gender marker legally. This is different in every state. Every state will let you change name. Not all states let you change gender marker on various different types of documentation. But most will let you at least update a driver's license. The federal government will let you update a passport, update gender marker on a passport with a doctor's letter. So all trans people who are US citizens can at least get that documentation. Last is medical transition. Most trans folks, if they have resources and access to this, will choose to go on hormones, but not all do. And it's perfectly reasonable to choose. You just decide what your goals are and, get the medical care that you need to meet those goals. My job is medical transition. I manage people's hormone regimens to help them develop the secondary sex characteristics that they're looking for. And then the other part of medical transition is surgical. So some people get surgery, some people don't. Trans men have a lot of options. They can get their breasts removed. We call that top surgery. They can get some various different types of what we call bottom surgery, either creation of a penis from a graft of tissue or just lengthening of the clitoris. Trans women, we usually look at facial feminization surgery, breast augmentation, and vaginoplasty. Some people choose to have surgery, some people choose not to. It just kind of depends on what's important to you, what's important, how you see yourself, what's causing dysphoria. You know, some people need breast augmentation because they don't get a great results with hormones, and some people get fantastic results with hormones and can avoid that one. It all just depends on what you're starting with.
Right. And what are some of the changes that someone could experience if they're going through this?
With hormones? So if you're on estrogen, we see a number of things. We see mental health changes first. People talk about feeling more mellow, less impulsive, you know, just all the things that happen when your testosterone falls. We see breast growth. So you'll start with breast sensitivity. You get a little breast bud, just like, you know, pubertal cis girls get. The breast will grow slowly over time. Fat distribution changes. So instead of all the fat going to your belly, it goes to your butt and your hips. We see a slowing down in the growth of facial hair and body hair, but usually the facial hair won't go away completely. We have to do laser or electrolysis if you want to get rid of that. After a year or so, we'll start to see some changes in the face. So we get more subcutaneous fat under the skin. Everything kind of rounds out and gets a little bit more soft. Skin gets softer. What else? Genitals shrink, sex drive goes down a little bit. I think that's most of the main stuff. Folks who are on testosterone will experience most of the opposite. So we see a lot of body hair growth, facial hair growth. Acne gets worse. Sex drive definitely goes up. Sometimes it's a welcome change, and sometimes it's not. Just depends on the person. We see some genital growth as well. Body fat distribution also changes. Their hips will shrink and they put on more fat in their belly. Metabolic rate goes up, which is nice. You put on a little bit more muscle and your appetite goes up to maintain everything. We usually see some pretty significant mental health changes with both testosterone and estrogen. People, since we're relieving the dysphoria, people just feel better. A lot of times people can come off their antidepressants and things like that. Some people still need to stay on them, but one of the best parts of this job is just watching people bloom into themselves. It's fantastic.
Yeah.
Mm-hmm.
And so let's talk a little bit about surveillance, right? Because that's really important. We know that there are some healthcare disparities that exist in this arena. So what's important for trans men in terms of healthcare surveillance and continuing to be healthy?
So both trans men and trans women need to follow up with all the routine healthcare maintenance stuff. You know, get your vaccines and get your colonoscopies and eat a healthy diet and exercise and all the stuff we tell everybody. Things that are gender specific. The big one that we talk about is Papsmears for trans men. And one of the big reasons for that is most OB-GYN offices are very, you know, woman-centered. The patients are all women, and so it's kind of weird or a lot of times the front desk staff will be a little bit confused if a, you know, guy with a beard shows up saying that they're there for their gynecologist appointment. But as long as you've got a cervix, we should screen it for cervical cancer, because that's not a fun way to go. The screening recommendations are the same for trans men as they are for cisgender women. So every 3 years until you're 35, you can lengthen it to every 5 years with an HPV test at the same time. But there are a couple of things that are different with trans men. First of all is if you're on testosterone, we generally see what's called vaginal atrophy. So things just get a little bit more dry, a little bit more easily irritated downstairs. Same kind of thing as we see with postpartum breastfeeding, same thing we see with menopause. It can make a pap smear even more uncomfortable than it would already be. So we generally recommend using some estrogen vaginally for a week or so beforehand to make everything more comfortable. Another thing to recognize is that a lot of trans guys don't use their vagina at all for anything. Some people do and some people don't, but frequently that's not something that is used sexually. And so the dysphoria from having attention on that body part, coupled with the fact that nobody's been in there possibly ever, can make the exam very uncomfortable. So it's important for the gynecologist or the PCP doing the pap smear to be cognizant of that and to take things slow, talk to the patient beforehand, explain this is what we're going to do. Do you want me to talk you through it? Do you want me to just be quiet and get in and get out? Different people have different preferences, but it's important to make sure that people are comfortable. I also do a lot of risk benefit counseling with my patients. We'll talk about, here are the risks that contribute to cervical cancer. So if you've had a lot of sexual partners, if you're having a lot of kind of standard penis and vagina intercourse, that's the best way to get HPV transmitted. And you've had multiple partners, it's been unprotected, we should think about pap smears. If you're somebody who's never had sex or who's never had any kind of penetrative sex, you haven't had very many partners, you're planning to get a hysterectomy in a few years, it's reasonable to delay a pap smear for a couple years, especially if you're going to get that part removed and not need it anymore.
Right.
The only other thing that's different for trans men is mammograms. Even though you're a man, if you have breast tissue, you should get a mammogram. Many trans men do choose to have their breasts removed. It definitely affects how society views and genders you, so that's a very popular surgery. But if for some reason you do still have breasts and you hit 50 or whatever the recommendations will be by the time we get there, you should still have a mammogram for that.
And for trans women, what are the recommendations for screening?
For trans women, they're similar. We do talk about mammograms. So again, anybody with breasts should have a mammogram. For our trans women, we recommend starting around age 50 after at least 5 years on hormones. Okay. So if you start your hormones at 48, you get your mammogram at 53. Of course, these guidelines are fluid and, they are updated pretty frequently. But mammograms are still important. The other thing to think about is prostate screening. We don't do a whole lot of prostate screening even in cisgender guys anymore. But even if a trans woman has had vaginoplasty, the prostate doesn't ever get removed. It's always still there. Luckily, estrogen or really just suppression of testosterone will shrink the prostate and that was one of the treatments for prostate cancer in the past was high dose estrogen. So the risk of any kind of prostate issue is pretty low, but still something worth bringing up to your primary doctor when you're talking about healthcare maintenance, cancer risk screening. Just remind them, hey, by the way, I have a prostate.
And so it just seems to me that a lot of things that we need to do, not just as healthcare providers, but as society, is just really be open and continually updating ourselves, not just on terminology, but obviously on recommendations and guidelines, because they are seeming to change, and continue to be educated so we can educate our patients and be more open. Any sort of, final tips or recommendations for both healthcare providers and the population at large when it comes to providing healthcare in this arena?
I think one of the most important things is just to realize that trans people are just people. There's not a trans agenda. Trans people aren't scary. They're not men trying to get into the women's bathroom. They're just people who have a medical problem who are, trying to live their life and not cause trouble for the most part. Yeah. And things have changed a lot in the last 5 or 10 years. Being transgender used to be the butt of jokes. It was the whole point of Ace Ventura. That was like the whole climactic part was, oh, look, this woman is transgender. Luckily things don't fly anymore. And things have definitely been getting better, but we still need to continue educating ourselves and making sure that we are creating spaces that are inclusive. Being transgender is one of the most, we don't call it a mental illness, but gender dysphoria has one of the highest risks of suicide of any medical condition. Trans folks, 40% of them have attempted suicide. And yeah, that's huge.
That's a very alarming statistic.
Yeah, 40%. And the thing that we have found that decreases it is family and peer support. So if people are supported, if they're affirmed in who they really are on the inside, that rate goes down to, the 5% that you see with cisgender people. So yeah, that's pretty much the important thing. Trans people are just people.
No, well, I appreciate so much of your insight and education today. This is just really just an introduction to so much more education that, is needed. And I really appreciate you contributing this education to us. I think it's such a valuable topic, and it's not easy to find. It's not easy to find healthcare. It's really not. It's not easy to find healthcare experts that can speak about this, who actually practice this in their practice. And so thank you for providing that knowledge.
Thank you for having me, and thank you for even being willing to address this in a women's health summit. It's important, and it's important to see representation of trans folks in these sort of spaces.
Definitely. And we hope to become we hope to be as inclusive as possible. And I think there's still a lot of work to be done. So.
Well, but we keep doing it.
That's right. I think that's the most important part, is just listening. And, I think that the way this came about actually was someone in the community reached out to me, said, I saw you're hosting this summit. I don't see any lectures on transgender care. And I was like, educate me, and let's get it on the schedule. Let's do that. Because, I didn't have the resources to do it myself by any means. So, thank you for being an expert. And we have a few more experts as well. They're joining us, and we're super excited about them too. But where can people find you to learn more, to, even see you if they'd like to see you in Houston, Texas, or near Houston, Texas? What's your website and your Instagram handle or Facebook?
So our website is Braeswood Endo, BRAESWOOD endo.com. And I think it has all our social media on there. It's facebook.com/Braeswood Endo. Our Instagram handles at Braeswood Endo as well. And my contact information is on the website. If anyone has questions or anything, my email's on there. If anybody uses anything old school like email anymore.
No, everyone uses email.
But happy to answer any questions, or if anybody needs resources or anything like that.
All right, awesome. Thank you so much, and hopefully another educational session to come up soon once you've had your baby. Had some time to rest. So,
Great. Well, thank you so much for having me. It was good talking to you today.
Take care.